So, hello everyone. We are live again on the platform of Vardaan. As you all must be knowing by now, that Vardaan is an organization which caters to the medical and the spiritual aspects of pregnancy, preconception, and infancy. So on the platform of Vardaan, we bring to you the medical knowledge and the spiritual knowledge, and there is this combination of both the knowledge which helps you to understand the intricacies of how preconception, pregnancy, and infancy are actually it is affected by both the medical and the spiritual there is the spiritual and the medical sciences, they come together to actually create the entire happenings that is going through the process of these three stages which we call as the golden period. So the golden period is the 3 months before conception, that is the preconception, 9 months of pregnancy, and hello Neetuji, and 2 years of infancy, which makes it as 1100 days. So on the platform of Vardaan, we bring to you various topics related to the medical aspect and the spiritual aspects of the golden period education. And I would love to have your comments on the present topic, and also would love to understand what topics would interest you so that it becomes easy for us, and we would like to focus on the topics of your interest. So maybe you can just leave a comment as to what video would you like to have in the next session on the next Saturday. So we are conducting this live session every Saturday at 9 p.m. And so please do join us on every Saturday, and keep sending us the topics of your interest. So we will try and address those topics. So today's topic of discussion is the why and when of cesarean section. So what is cesarean section? We just need to understand that it is a mode of delivery which is not a vaginal delivery, but the delivery of the baby is done with an incision. That means a cut is given on the abdomen and then on the uterus, and the baby is delivered through the abdominal route. The normal delivery that we see is the vaginal route, but if the vaginal route cannot be taken into the being, then it has to be through the abdominal route, and that is called a C-section or a cesarean section. The cesarean section can be needed because either as a planned cesarean section, it could be a planned cesarean section, or it could be an emergency cesarean section. So there are various indications of a planned cesarean section. Emergency cesarean section can be because of various reasons, that the patient is already in labor, the process of normal delivery is planned, and the mother is going through labor, but because of certain conditions, cesarean section has to be done. So these certain conditions could be that there is the baby's fetal heart is not okay, the labor is not progressing well as expected. For example, if we see that if your doctor sees that the anticipated time is say for example 2 or 3 hours, but the labor is not progressing well, the baby is not descending, the cervix is not dilating, so the doctor might decide for C-section. So this is called an emergency C-section, because the patient was actually planned for a normal delivery, normal vaginal delivery, but because of certain these conditions, it has to be decided in favor of a C-section. The planned cesarean, or there could be bleeding during pregnancy, and a few more reasons can happen. A planned cesarean section is where your doctor decides for a cesarean section directly without having the mother to go for a normal delivery. Not the process of labor here is not undertaken, and It is just that it is decided that we will not go for a trial, we will not go for, we will not let the mother go into labor, and we will take the mother straight away for a cesarean section. So what these indications could be for a planned cesarean section is there could be either a very big baby, and the passage to the baby may be small. Either normally what the passage should be, it is smaller than that, or because the size of the baby is bigger and your doctor feels that it's going to be difficult for the baby to pass through the passage. Then it could be intrauterine growth retardation, that there is something, the baby is not growing properly, because if the baby is not growing well, then the baby is not in a position to undergo the the labor, the hardship of the labor. It becomes difficult for the baby to undergo that stress of labor. So intrauterine growth retardation, where the baby is smaller as compared to what the baby is expected to be at that point of time during pregnancy, or there is the liquid, the fluid around the baby is lesser as compared to normal, because this the fluid around the baby is very important. When the uterus is contracting, then this fluid works as a buffer. So if this buffer is not adequate, so there could be chances that during the stress of labor, there is the baby goes into distress. So your doctor may decide for a C-section. Then other indications could be the baby is breech down. Normally the baby is head down, but if the head is on the upper side of the uterus and the baby's buttocks are on the lower side, especially in the first time pregnant mothers, that means in the primary mothers, then normally this becomes an indication, because nobody wants to take a risk of normal delivery, because you can see the most incompressible part is the head. So when the baby's head is down, once the head is delivered, it becomes easy for the rest of the baby to pass through the birth canal. But when the baby is breech down, that means the buttocks are down, then once the baby's body delivers, the head is the last to come, and at times there could be possibility that the head might get stuck and the baby may go into distress, and a lot of negative complications may happen. So if the baby's buttocks are down, then, and especially for the first time pregnant mothers, it is normally a trend to go for an elective C-section. Now, other indications could be that the placenta is down. Normally, the placenta is placed on the upper segment of the uterus, but at times it is the position is reversed. That is, the baby is up and the placenta is in the lower segment, which we call as placenta previa. And if the placenta is low and the mother goes into labor, it becomes very, very risky, because there could be a lot of bleeding. So your doctor or your obstetrician will decide for an elective cesarean section. So these are a few indications to name, but these could be the reasons why your doctor may decide for a planned cesarean section, and the mother will not be allowed to go in labor. And even if coincidentally the mother goes in labor, then a emergency cesarean section will have to be done for all these reasons which I have narrated now. Now, there could be, you may have a feeling that once a cesarean section, so it's always going to be a C-section. So it is not actually like that. There could be certain reasons where it is going to be a repeat cesarean section. For example, if the the birth passage is small, it will be small in the subsequent pregnancies also. So that becomes a reason for a repeat cesarean section. Or if multiple pregnancies, I would like to mention a word on the multiple pregnancies. If it is 3 twins still is a possibility for a normal delivery in case the presentation of the baby is all right, like the head is down, everything is fine, both the babies are head down, and the babies are average size, and the birth passage is all right. So your doctor may decide to go for a normal delivery. In fact, it is always decided for a normal delivery if everything is okay. But yes, certain conditions may be there, especially when the number of babies is more than two. For example, triplets, we never give a trial for a normal delivery, because the as the babies, they deliver, like first baby delivers, the uterus contracts, and the second baby delivers, the uterus further contracts, and the placenta starts separating, and it may become a little risky for the third baby who would deliver. So in the multiple pregnancies, more than two is always an indication for a cesarean section. So there could be certain recurrent reasons that this reason is actually there, and it is a sort of a permanent reason. Then it is always going to be a C-section. But if it is not a recurrent reason, then your doctor may decide to go for a normal delivery with a previous history of a cesarean section. So I would also emphasize on the point that you should be very, very aware of the reason why you had the first cesarean section. And also please keep your notes, preserve your notes very well, because your doctor is going to ask you in the subsequent pregnancy the reason for the C-section, so that it becomes easy for to decide on the mode of delivery in the current pregnancy. Because a lot of times I come across mothers who have no idea about why the cesarean section was done in the first time. So it becomes a little difficult to plan this the delivery in the present pregnancy. So a word of caution on that. Always keep the records handy with you. Always preserve your records, unless you have decided not to conceive in future and your family is completed. So then it is absolutely a different ball game. Now, if it is said that it has to be a planned cesarean section or an emergency cesarean section. Now, what next? What preparation is needed? For example, if you are going for an emergency cesarean section, then of course your doctor is going to decide on the different aspects, like you will be given some medicines and so on and so forth, and the section will be done. But if it is a planned cesarean section, you have to be cautious that at least 6 hours before you should not take anything by mouth, not even water, because you have to be nil by mouth for 6 hours. Water is okay, like 4 hours is okay for water, but nothing solid has to be taken for at least 6 hours before the surgery is planned, before the time on which the surgery is planned. Then take care to clean your abdomen nicely, and at times there could be instances when the mother actually neglects the umbilicus, which is a source of infection. So take care to clean the umbilicus. Take care to take a proper bath before leaving for the hospital. Clean your abdomen at least once or twice with soap and water, and reach the hospital well on time, so that because the preparation also takes around 1.5 to 2 hours before you can be taken to the operation theater for the surgery. The anesthesia that is given for a cesarean section could be either spinal anesthesia or a general anesthesia. Spinal anesthesia is definitely safer as compared to general anesthesia. So if your doctor advises, if your anesthetist advises you on spinal anesthesia, rest assured that that is safer as compared to the general anesthesia. So your doctor is advising. Unless there is a contraindication to spinal anesthesia, it is always preferred. It is always the preferred choice, because of course it is safer. So that is why it is preferred. So and the there is a misconception that subsequently there could be backache, there could be a headache, but normally it doesn't happen if it is given properly. And the needle that is used for spinal anesthesia is a very fine needle these days, so normally it doesn't cause any complications. So don't worry on the subsequent side effects. But of course, if the present procedure is going to be safer with a spinal anesthesia, so generally don't try to refuse it, because if you already have a backache or if you already have a complication, then your anesthetist will not advise you on the spinal anesthesia. So let them take the decision for you. So that is another word of caution, because a lot of people, they are actually afraid of going for spinal anesthesia, but it's safe. Now the cesarean section has happened, and the post cesarean section, it is nowadays, because cesarean section is done under spinal anesthesia, very fine needle is used, and the sutures that are used, they are also very good quality sutures. So the post-operative period is not very difficult actually. So you can, if the cesarean is done under spinal anesthesia, your doctor will advise you not to use the pillow for at least 24 hours. But when you are shifted to your room, then you can, as early as possible, I would recommend you to start feeding your baby. So for the feeding of the baby, you will not be able to sit up in bed, but yes, you can turn on one side. You can start as soon as the sensations in the lower limb returns. You can start folding your legs, and you can turn on either side, and you can start feeding your baby as early as possible. Because if when the baby is put to breast, the lactation will start, and the earlier the baby is put to breast, the better is going to be the lactation, and the baby also gets immediate feeding, so the chances of the baby going into hypoglycemia, like hypoglycemia is when the sugar levels in the blood of the baby reduces. So that is mainly because the feeding of the baby is delayed. So don't think that because a C-section has happened, so the mother has to become very, very comfortable for 6 to 7 hours, then only the mother is going to be able to feed. It is not like this. As soon as the mother comes to the room and is comfortable in the bed, within say 1.5 hours, the baby can be put to breast, and the breastfeeding should initiate, because that is what is the need of the hour. The earlier the breastfeed is initiated, the better is going to be the quality and the quantity of the milk that is secreted. Now in the bed, you the mother has to be encouraged to take up breathing exercises, like deep breathing exercise, because too much of movement cannot be done while the mother is lying in bed. So just the limb movement, as soon as the sensation in the lower limbs returns after spinal anesthesia or after general anesthesia, there is no problem with the movement of the lower limbs. So the movement of the lower limbs should be encouraged as early as possible, because during the process, during the pregnancy, period of pregnancy, and also in the puerperium, that is the immediate postpartum period, the blood is quite thick. So there is a tendency of the blood to clot in the veins, and this can lead to difficulty in future. So the deep breathing exercises, which helps increase the circulation of the blood and the movement of the body and the limbs, is very, very important in the immediate postpartum period. That means immediately after delivery. So the mother should be encouraged to start moving limbs and to deep breathe as early as possible, as early as the mother is comfortable. On those lines only the exercises should be started, and also the baby should be put to breastfeed. And especially when the mother starts handling the baby, then again it also increases the activity of sorry, increases the activity, and it is beneficial for both the mother and the baby. So this is very important in the post-operative care. And as far as the diet is concerned, after general anesthesia, you can start sips of water after 2 hours, and after general anesthesia, you can start sips of water about after 4 hours. And after say if the mother is able to tolerate water well, so maybe around 1.5 hours later, depending on your doctor's instructions, the mother can start taking some other liquids other than water, like maybe tea, coffee, milk, soup, dal water, coconut water. And after general anesthesia, so all these liquids can be started after 4 to 6 hours, depending on the condition of the mother. So, and on the second post-operative day, the mother starts with the semi-solid diet, and on the third day, she can start with the solid diet and the normal diet. So, actual recovery from the C-section is, it takes around 2 to 3 days to actually start doing own activities, meaning handling the baby, getting out of bed, using the washroom. And once the baby, nowadays the dressing that we do on the third post-operative day is also a waterproof dressing. So that really helps the mother to go home and take a bath properly. Like in the earlier times, it used to be that, oh, the mother will not be able to take, the bathing is restricted because we don't want the sutures to be wet with water. But these days, with the advances in the science, we are using waterproof dressing on the third post-operative day, and the mother can easily go back home and take a proper bath. And the sutures that are used are also for the stitch line. We're using dissolving sutures, so the fear of later the stitches have to be removed and it's going to be painful is not there, and things are very comfortable. So if anybody has any questions, I would love to answer them. Please write in your chat box. I think I have covered most of the the queries, or maybe regarding the cesarean section, but still, if anybody has any query, I would love to answer. So I think it's all done. And thank you so much. Thank you everyone for attending today's session. And I look forward to meeting you again on next Saturday, same time, 9 p.m. And if any topic interests you, please write in the comment box so that we can address those topics in future sessions, future live sessions. Thank you once again for joining us.